Signs your heart may be in trouble. Hello, and welcome to our video on signs that your heart might be in trouble. Your heart is a vital organ that keeps your body functioning properly, but it's important to recognize when it might be struggling. In this video, we'll be discussing some common signs that could indicate your heart is in trouble and what steps you can take to keep it healthy. Chest pain. One of the most common signs of heart trouble is chest pain or discomfort. This can feel like pressure or tightness in your chest that may spread to your arms, neck, jaw, or back. The pain can continue for hours and you'll feel tenderness in your chest. If you experience this type of pain, it's important to seek medical attention right away. Shortness of breath. Another sign that your heart might be in trouble is shortness of breath. This can happen when your heart is not able to pump enough blood to meet your body's needs, and it may be blocking your artery, which can make it difficult to breathe. If you experience shortness of breath, especially during physical activity, you should speak with your doctor. Fatigue. Feeling tired or fatigued can also be a sign of heart trouble. When your heart is not working properly, it can't pump enough blood to supply your body with the energy it needs, and your heart won't be able to transfer blood to other organs as well, which can leave you feeling tired or weak. If you're experiencing persistent fatigue, it's important to talk to your doctor. Swelling. Swelling in your legs, ankles, or feet can also be a sign of heart trouble. This happens when your heart is not able to pump blood effectively, causing fluid to build up in your body and causing bloating. If you notice swelling in your lower extremities, you should consult your doctor immediately. Irregular heartbeat. Another sign that your heart might be in trouble is an irregular heartbeat, which is also known as arrhythmia. This can feel like your heart is skipping a beat or beating too quickly or slowly. Arrhythmias can be caused by a variety of factors, including heart disease, high blood pressure, stress, certain medications, and electrolyte imbalances. While some arrhythmias are harmless, others can be serious and require medical attention. Nausea or indigestion. Feeling nauseous or experiencing indigestion can also be a sign of heart trouble. This can happen when your heart is not able to pump enough blood to your digestive system, causing discomfort or pain. If you experience these symptoms, it's important to speak with your doctor. Lightheadedness or dizziness. Feeling lightheaded or dizzy can also be a sign of heart trouble. This can happen when your heart is not able to pump enough blood to your brain, causing a temporary loss of consciousness, and it makes you feel tired and low on energy every time. If you experience these symptoms, it's important to speak with your doctor. Family history. Another factor that can increase your risk of heart trouble is your family history. Family history plays an important role in any cardiovascular disease. If your parents, siblings, or other close relatives have a history of heart disease, you may be more likely to develop it as well. It is important to discuss your family history with your doctor and take steps to reduce your risk. Lifestyle factors. Finally, certain lifestyle factors can also increase your risk of heart trouble. These include smoking, being overweight or obese, having a sedentary lifestyle, and eating a diet high in saturated and trans fats. By making healthy lifestyle choices, such as quitting smoking, walking, exercising regularly, and eating a healthy diet, you can reduce your risk of heart disease and keep your heart healthy. Sweating. Sudden sweating, especially when you're not exercising or in a hot environment, can be a sign of heart trouble. This is because when your heart is struggling, it can cause your body to go into fight or flight mode, which can cause you to sweat. Sleep apnea. Sleep apnea is a condition where you stop breathing briefly during sleep, can also be a sign of heart trouble. This is because sleep apnea can cause your blood oxygen levels to drop, which can put a strain on your heart. Jaw or neck pain. Jaw or neck pain can also be a sign of heart trouble, especially in women. This is because the nerves that supply the heart also supply the neck and jaw, so pain in these areas can be a symptom of a heart problem. It is not a type of classic heart pain. The pain sensation occurs first in the jaw and then it travels down to the heart. Age and gender. Your age and gender can also play a role in your risk of heart trouble. Men over the age of 45 and women over the age of 55 are more likely to develop heart disease. The older you get, the more the chances of heart problems occurring. Women are also more likely to experience typical symptoms, such as jaw or neck pain, shortness of breath, and nausea. Feeling anxious or uneasy. Feeling anxious or uneasy, particularly if it's accompanied by other symptoms, may be a sign of heart trouble. Difficulty sleeping, especially if it's accompanied by other symptoms. Difficulty sleeping or waking up suddenly, gasping for air, may be a sign of heart trouble, particularly in people with heart failure. Fainting or near-fainting spells. Fainting or near-fainting spells, particularly if they're accompanied by other symptoms, may be a sign of heart trouble. Prevention. While some risk factors for heart disease, such as age and family history, cannot be changed, there are many things you can do to prevent heart trouble. These include eating a healthy diet, getting regular exercise, not smoking, managing stress, and maintaining a healthy weight. If you have concerns about your heart health, it's important to speak with your doctor. They can recommend lifestyle changes, medications, or other treatments to help keep your heart healthy. Edema. Edema, or fluid accumulation, is a symptom that can be associated with various forms of heart disease. When the heart is not able to pump blood effectively, fluid can build up in the body, causing swelling or edema. This can occur in different parts of the body, such as the legs, ankles, feet, or abdomen. One type of heart disease that can cause edema is congestive heart failure. This is a condition where the heart is not able to pump blood efficiently, causing fluid to build up in the lungs and other parts of the body. Symptoms of congestive heart failure can include shortness of breath, fatigue, swelling in the legs or abdomen, and rapid or irregular heartbeat. Another type of heart disease that can cause edema is valve disease, which occurs when the valves of the heart do not function properly. This can cause blood to back up and pool in different parts of the body, leading to edema. Other forms of heart disease that can cause edema include cardiomyopathy, arrhythmias, and coronary artery disease. In some cases, edema may be a side effect of medications used to treat heart disease. Loss of appetite or sudden weight loss. Losing your appetite or experiencing sudden weight loss, particularly if you're experiencing other symptoms, may be a sign of heart trouble. A feeling of fullness or pressure in the chest. If you feel a sensation of fullness or pressure in your chest, particularly after eating or during physical activity, it may be a sign of heart trouble. Nausea or vomiting. Feeling sick to your stomach or vomiting, especially if it's accompanied by other symptoms, may be a sign of heart trouble. Persistent coughing or wheezing. A persistent cough that produces white or pink mucus or wheezing may be a sign of heart trouble, particularly in people with heart failure. Your heart is a vital organ that requires attention and care to keep it healthy. It's important to note that not everyone with heart trouble will experience all of these symptoms, and some people may not have any symptoms at all. If you experience any of these symptoms, it's important to talk to your doctor. They can help determine if these symptoms are related to heart trouble and recommend appropriate tests or treatments to manage your condition. Remember, taking care of your heart is an essential part of living a healthy life. Thank you for watching. Make sure to like and subscribe. See you next time.